example of this is the connected care-mobile to our left here. An 18-wheel telehealth clinic outfitted with Cisco Health Presence, which will travel the country as part of the United States of Healthcare tour. Now the average American can protect his or her
You
health
oppose single payer, right?
with the same
You oppose single payer because it would wipe out your profits and put the interests of the American people above the interests of your corporation. That's why you oppose single payer, right? You oppose single payer because why do you oppose single payer? Because it puts the interests of the American people above your interests. You're not going to be able to keep going. You're not going to be able to keep going because, I'm sorry, sir, you put the interests of your corporation, the interests of the executives above the interests of the American people. That's why you oppose single payer. Why don't you address single payer? Why do you oppose it now? Why do you oppose single payer? You're here in a public park putting the interests of your corporation above the interests of the American people. I'm not done. I want to know about why you oppose single payer. Tell me now. No, I want to know right now from you why you oppose single payer. I want to know from you, sir, why you oppose single payer. Why do you oppose single payer? You put the interests of your corporations above the interests of the American people. 60 Americans dying every day from lack of health insurance.
You want to know why we oppose single payer?
Yeah, I want to know why. I want to know from him why he opposes single payer.
I'm happy to talk to you about it. Do you want to come out? Do you want to come and talk about it, or do you want to shout? Do you want to disrupt the
No,
press
it's
conference?
single payer. Put single payer on the table because it would wipe out the health insurance industry.
Do you want to talk about it?
No.
You just want to shout? Do you want to hear what they have to say, or do you want to shout? Because they're talking about health reform. You got to be confused.
I'm embarrassed by 60 Americans dying every day from lack of health insurance. That's why I'm embarrassed.
Okay. Do you want to come on and talk about it, or do you just want to shout?
How do we serve the needs
What's
of
your name?
those Americans who deserve
What's your name?
care and who
I'm sorry, what's your name?
What's your name?
My name's Don Nathan with
Who you
United
with?
Health Group.
Yeah, okay.
I'm sorry,
How
your
much
name
does the
again?
chief executive make a year?
Publicly disclosed every year. How much do
We
you
are
make?
redoubling our
What is your name,
efforts
and who are you
What's
with?
his name?
I'm sorry, what's your name?
Underserved Americans
That's Dr.
have
Reed
access
Tuckson,
to
Chief
the
Medical
care
Affairs.
that
I'm sorry,
they
you don't
need.
want to say your name?
We are redoubling our efforts.
sorry, what was your name
through
again?
These comments today.
What was your name again?
What is your name, sir?
Right, once again, it's Don Nathan, United Health Group. What was your name?
What is your name?
My name again is Don
Like
Nathan.
Cisco to put it to service to the poorest and neediest of American communities. We are extremely proud of what we are doing, and I will assure you that as Mark continues his remarks, we remain focused on the people who are in need, and we will not be distracted on the social mission that we are about today. Thank you, Reed. As I said at the outset, our mission is to bring technology to bear, partnering with United Health Group and with government to help bring better health care to all Americans. The impact of these sorts of technologies and of open and highly secure technology networks that bring together information, healthcare services, and people